My name's Teresa Ritter, and I was diagnosed at the age of 21 of chronic kidney disease. I had renal reflux of the kidneys, and in those times when they diagnosed it, they did not have a cure or treatment, and they weren't sure what it was. So after many tests and not growing as a baby, they were able to diagnose me and fix it, but by then the damage had already been done to my kidneys.
There is one condition called congenital kidney disease. Most common among those is called a reflux kidney disease, where the valve between your ureter and the bladder is not working well. Eventually that leads to a recurrent kidney infection, and people actually can damage the kidney and can be on dialysis as well.
A lot of times you feel bad, you're tired, you're nauseated, you're not hungry, you lose your appetite, but on the outside you look fine, so people don't really understand what you're going through because they look at you and they say, you look fine. Well, inside you're not, and it's hard for them to make that connection because first of all, they've never been there before, they don't know what it's like, but you look absolutely like everybody else.
As more and more toxins start developing in the build up in the blood, they get more symptoms of toxemia in the form of nausea, vomiting, weak, tired, lethargic, sleepy.
It wasn't until I was about 29 when I needed a kidney transplant, and my mom donated March 17th, 1999, on St. Patty's Day, her kidney, and it's been 15 years now. After my surgery, it was amazing because I was in such denial before the actual transplant that I felt better immediately. I was up and about, I had more energy than I had ever had before, and couldn't believe I had waited so long. People ask me questions, and I try to explain my situation and how I was in a lot of denial and I didn't have the help, I didn't have the resources, so I was scared and I was not sure of what was going to happen. The unknown was really terrifying to me. So I do like to tell people it's not as bad as you think. In fact, if anything, after the transplant, I felt 100% better, and again, my quality of life had changed immensely, and I was able to go back to work full time. I got married, I had a baby, and he's 10 years old now, and I was able to live a life like everybody else. I unfortunately need another transplant. So my sister is going to donate in May.
For a living donor transplant, there is something called a pre-emptive kidney transplant, which you can do it when the kidney function has gone down to very close to be on dialysis, because that surgery can be scheduled electively and can be done in timely fashion before the patient gets on dialysis. I would say sometime between 15 to 20%, that's when it's good to get a living donor kidney transplant.
I think that people need to know that yes, it is a very hard diagnosis. It's not easy to change your lifestyle in order to stay healthy or to feel better, but to know that there are resources out there, and then not to be scared of the unknown, that the more people you talk to, the stronger you'll get, the stronger you'll be. I waited way too long the first time, and I regret waiting that long because I felt so much better after I had my transplant. I was scared to go on dialysis, and then knowing what I know now, I wouldn't wait that long because I know dialysis does make you feel better, but you're scared, you just don't know. I want people to be able to know that they're not alone, that there's so many people out there, and we just don't talk about it because, we don't want to burden other people with our troubles. And it's hard to talk to people that can't relate to what you're feeling. So, ask the questions, reach out to people that have things that are similar to what we're going through, because you just have to know you're not alone. There's a lot of us out there, and we need each other to support each other.